You've seen what you've done. I don't want to repeat, because you've been to many of those areas. You've seen the oxygen plant that is serving this facility very well, and of course the other facilities around here. Test of 6,200 patients. We have had active positive cases, about 2,400, and I'm happy to report, Waziri, that about 2,200 of those have been treated and been released to go home. Unfortunately, we have had 88 deaths so far, so we are still asking our people to continue, observing the protocols as guided by your ministry. But we really want to thank you for the support that we've gotten. We got support from the national government of about 152 million to fight COVID. Those funds have been properly used. The funds have been prudently managed, and I want to announce here that even when other counties and issues to do with the misuse of COVID funds, Meru County was cleared by the Senate because of prudent use of the funds that were allocated by the national government. Finally, Waziri, we've been able to vaccinate 25,600 patients, or rather not patients, sorry, 600 people with AstraZeneca, the first dose. We got the second dose, only 10,000 doses, and that has also, we have vaccinated 10,000 people. We are requesting, Waziri, I know you are doing a lot in that area, we are requesting if we are able to get more doses, because there is quite a bit of pressure from the people who got the first dose. So the balance of the about 15,000 or 16,000, there is quite a bit of pressure, from those people who want the second dose, and of course also others who want to get new doses. Mheshimiwa Kagwe, what we are also doing at our histopathology laboratory, where we are able now to send a specimen, or rather, to be able to diagnose cancer specimen, and that has also reduced the cost from 6,000 to 1,500. Previously, we used to send this specimen to Nairobi. It would take about 21 days before we get the results, and that time now has been reduced from 21 days to 3 days. So a lot is happening here, Mheshimiwa Kagwe. You've also seen our new cancer center, ICU, which so far, since we opened it in July, has served over 100 patients. Very, very modern indeed, and it's quite useful in this region. We are also very grateful, Mheshimiwa Kagwe, because we have a modern, the one that we just opened, Areno Dialysis Center, that became operational in 2020. This was an upgrade to the already existing 5-unit dialysis machines that have been set up in 2015. And this has seen the number of dialysis patients attended increase from an initial 8 patients per day to a minimum of 24 patients dialyzed on a daily basis. The Rano unit caters for patients from neighboring counties, Isiolo, Marsabit, and parts of Laikipia, and even Tharaka Nithi. So down here, Waziri Kagwe, we are constructing a new ward block, of course, with support also from the national government. It's a more than 240-bed story ward block, and once this is completed by end of this year, there is a phase 2, which will commence immediately thereafter, and the phase 2 will have an additional 5-story building that is going to increase the capacity by another 240 beds. So indeed, we are going to have a complete wing that will be the mother and the child wing of Meru Teaching and Referral Hospital.
It is really congratulations to this hospital. I think that the members of the press have impressed us and been covering intensely about the issue of oxygen in the country. And I would like to say that this is not something that started lately. As far back as April of last year, we started discussing and talking about the importance that oxygen supply was going to play into the future as COVID-19 intensified in the country. But I think it is also important for us to appreciate that oxygen is not just important for COVID-19. It is also important in our ICUs for various conditions, because essentially it deals with the issue of respiratory issues, and those can come in many forms. And this plant is really a true indicator of how proactiveness can save lives in the health sector. The 35 million project was installed to retire an old plant that had run its course, and this is a new one. The new plant has a production capacity of 480 liters per minute and capability to refill 8 oxygen cylinders every 2 hours, translating to 96 liters in 24 hours. And that, ladies and gentlemen, can be extremely important, particularly when you've got a pandemic like the one that is in our country. I'm pleased also to note that this new plant has enabled the county to supply piped oxygen to the isolation facility, as well as supply oxygen by cylinders to all sub-county facilities in Meru County. Your proactiveness is indeed a learning point for all other counties. Fellow Kenyans, oxygen has been a critical component in the fight against the virus in the country. And to address the issue of oxygen supply, the ministry has formed an oxygen committee whose mandate is to focus on mobilization and allocation of resources to cover oxygen gaps in the country, informed by the counties. I want to thank all those counties for making their own investments to ensure that there is sufficient oxygen supply in their hospitals. Securing consistent oxygen supply requires diverse approaches that are tailored to each health facility. Through the support of the World Bank, the ministry has procured almost 2 million liters of liquid oxygen through KEMSA, accessible to counties with liquid oxygen tanks. Provision have been made to avail oxygen supply through cylinders in emergencies. This oxygen supply support targets more than 317 hospitals across the 47 counties. In addition to the oxygen plant, I'm also pleased to officially open the new 10-unit renal dialysis center. And this is a real development and a real happening. There was a time, ladies and gentlemen, when in the whole country we didn't even have this capacity. And not just in terms of numbers, but in terms of the modernity of the equipment. And so once again, I want to congratulate the Meru County government for doing an excellent job in ensuring that people who are critically ill do not have to wait and then be transported to Nairobi or other facilities. As I said a while back last year, I did mention that we can be so overwhelmed, and it did happen for a while there. We can be overwhelmed to the extent that there is no need of transporting people from here to Nairobi or elsewhere. And I'm so happy to see today that for Meru, a lot of people who are here would not need to be transported to Nairobi because they can be taken care of in both the ICU and the HDU facility that is now available in this hospital. Once again, congratulations. Your Excellency, it is also notable that despite the challenges presented by COVID-19, the health facilities in this county have continued to provide basic primary health care services to residents of Meru County. It is a policy the Ministry of Health demands and requires that we take care of people at their homes, and access to health must be as near families as possible. And in addition to the facilities, I also want to congratulate you for deploying sufficient healthcare workers so that they are able to visit families rather than families come to visit hospitals. The new philosophy and policy that we want to adopt is one where we take health to people rather than people to health.